The reason we developed Sundhed.dk was to empower patients and health professionals by one, sharing health data, and two, sharing knowledge, mainly in the beginning about medicine, but also later on about diseases and diagnosis and general information about health and sickness. For the average citizen, Sundhed.dk offers insight in the healthcare system. We offer insights about your rights as a citizen and a patient, maybe becoming a patient at some point. And also, we try to build a bridge between the healthcare system and the prevention care that are mainly handled by the municipalities. Yeah, so that's the main offerings. To the healthcare professionals, we offer decision support in terms of general knowledge about diseases and diagnosis and various kinds of codes that you need on one side in your daily work. And on the other side, we offer patient information, mainly for patients that have been treated outside your main facility. That means if you have been treated at a general practitioner or in another region, and you come to a different region or a new doctor, then they can go on Sundhed.dk and get medical history, overview of laboratory tests, telemedicine, and EHR notes. The main reason that we have been so successful, in my view, is that many of the projects have come from organic growth. They have come from the roots, started out as small projects, maybe in one clinic or a couple of clinics, and then they have been scaled to a certain point, and from there taken over by a national entity. A lot of our work has also been based on general agreements. That means that at some point it has become part of the general agreements between the parts in the health sector. When they see an advantage with a solution or an area, they say, okay, we want to scale that internationally. We have tried also to force down initiatives from the top down, but that always turns out as a hard approach, and it's hard to get everyone on board in the time frame that you lay out. It's all about the implementation and a lot about culture, especially in healthcare. So you need to take that into account when you scale something. First of all, in Denmark, in particular, and in the northern countries in general, we have a lot of trust in the government and in the official establishment, and we have been basing our portal on that basic trust that we have there. That said, we know that misuse of data and a few incidents might cause that trust to vaporize. So we try to generate maximum transparency in what we do. Every time we make a new application or a new use of data, we explain to citizens and health professionals what we do with that data. And also we try to build in, where it's possible, a log, so every citizen can go onto the portal and see who has accessed the data on the portal, and by that empowering the citizens to know what has been done with their data. On top of that, we have audits where the responsible for the data sit down together with us and some other organization, and we try to take samples in the logs and try to see if there are any irregularities. We also have some IT system helping us look for irregularities. And every year we have a few cases where someone gets a fine or maybe lose their license or gets prosecuted because they have been misusing data. And that is usually the regions who are responsible put it up into the press when that happens, so we try to generate maximum transparency. As part of our operations, we have a lot of emphasis on information security, not just IT security, but information security. We try to regulate between us and our partners who use what data and what is it used for. And then we spend a lot of resources on trying to maintain a high logical and technical security around our infrastructure, and devote a large number of resources. Every time we make a change in our environment, we have, or at least a major change, have usually 4 major changes a year. Then we have external hackers try to compromise our system and try to see if they can locate intrusion holes and other weak points in our infrastructure. And if they find something, we correct straight away. So that's policy. And it costs a lot of resources, but we think it's worth it. That's a very good question. In Denmark, we have, since the beginning of the zeros, we have been digitalizing society, and a lot of the Danish society is digitalized. We had a lot of success between year 2000 and 2010, where most of the infrastructure and systems we have in place now were built. And I think the near future for us now is to combine the digitalized solutions into more intelligent solutions. And that means that now we have a lot of building blocks in our toolbox that we can use for telemedicine, for home care, for transparency, from empowering patients. And also, since we kind of accomplished sharing EHR, sharing laboratory, e-prescription, medicine is rolled out across the entire country. We now have the ability and the resources to dig into some new areas where we look at new applications of data in mobile health. We look at smaller projects that might not start as nationwide but could become nationwide one day, and devote resources into more research-like projects and pilot projects. So we're doing projects on complex interventions, which is questionnaires where patients can relate themselves to their diseases, then have a chat with the nurse about their disease. We're doing a lot to empower patients by trying to package information into something that is relevant for them. So mobile health is a big thing, and also the tying together of the hospitals and the municipalities, so you get the chronic patients tied in together with a more smooth way through the healthcare sector. That is something that we look into right now. And we have endless opportunities in that area right now. One of the main challenges we have with combining the data in the new way is that we used to make big national projects where we took the main sources of data, as I mentioned, EHR, laboratory tests, and medicine, and made that available on a nationwide scale. So now we have a national portal making smaller projects, and that gives a governance issue where our stakeholders sometimes says, should you really go into a minor project like that? But our vision is that some of the best projects starts in the clinic, starts with co-creation with the patients, and from there we pilot it and prove the value, and we scale it up, hopefully to a national level. That's some of the pilot projects that we have in the pipeline right now.